By the early 1900s, the US public was spending nearly 165 million a year on patent medicines, most of which were untested, unregulated, and often harmful. This created a moral panic, especially among religious leaders and reformers who saw false cures and toxic tonics not just as a health crisis, but a spiritual failure, a betrayal of public trust and a danger to the vulnerable. Religious organizations and public advocates began calling for truth in labeling, scientific testing, and public accountability, which helped push forward laws like the 1906 Pure Food and Drug Act, a precursor to the FDA. This moment was crucial. It shifted the conversation from unverified promises to ethical responsibility, setting the expectation that healthcare technologies and therapies should be both effective and morally accountable, a value clinical engineers uphold to this day. Let's take a closer look at what was happening in the early 1900s. The US public was spending about 165 million a year on patent medicines, equivalent to several billion today. These were often unregulated substances marked as miracle cures, and many of them contained alcohol, opium, or completely ineffective ingredients. As a result, public trust began to erode. The public started questioning whether their health was being exploited for profit. This growing skepticism set the stage for reform. In 1906, the Pure Food and Drug Act was passed, the first major federal law aimed at regulating the ingredients and claims behind medical products. It was a watershed moment. Truth in treatment was no longer just a moral ideal, it became a legal requirement. This shift laid the institutional foundation for what we now know as clinical technology oversight, ensuring that the tools and treatments we offer patients are not only innovative, but honest, tested, and safe. As we zoom in on early 1900s, we start to see a clear clash between profit and patient protection. Patent medicines were marked with bold, often false claims, cures for everything. But many were ineffective, harmful, or addictive. Marketing dominated the conversation, overshadowing scientific testing and ethical standards. Medical practitioners, religious leaders, and journalists started calling attention to this. One of the most powerful forces in reform was public advocacy. The muckraking journalism of the era, like Upton Sinclair's The Jungle, didn't just target the meatpacking industry, it also exposed health frauds. The resulting public outrage laid the groundwork for legislation like the 1906 Pure Food and Drug Act, a key predecessor to today's FDA. This was more than a legal shift, it was a cultural one. Truth, transparency, and safety began to matter in how we design and deliver healthcare tools and systems. These ideals now form the backbone of clinical engineering standards. As concerns about patent medicines grew, faith communities stepped into the public debate. Religious leaders and organizations condemned not only the dangers of unregulated drugs, but the deception behind their promotion. They framed truth telling as a spiritual imperative. Lying about health, about cures, about risk was more than unethical, it was a moral failing with life or death consequences. Many religious publications and sermons at the time called for accountability, not just from manufacturers, but from legislators and physicians too. Protecting the vulnerable, especially the sick, the elderly, and the poor, was seen as a sacred duty. This advocacy helped transform public health from a bureaucratic issue to a moral crusade. It's another key moment where the ethical roots of clinical engineering began to grow. The idea that technology must serve truth and justice, not just profit. What began as a crisis of trust in patent medicine led to one of the most foundational expectations we have today. Healthcare systems must be reliable, regulated, and transparent. This slide shows how clinical engineering grew directly from that legacy. Today, clinical engineers play a central role in maintaining the integrity of medical technology. They don't just fix equipment, they ensure that devices are tested, compliant, and safe before they ever touch a patient. Just as reformers once fought for truthful labeling, clinical engineers now verify technical truth through calibration, validation, and performance testing. In other words, the work of restoring public trust in medicine never ended. It just became more technical, and engineers became its guardians. By the early 1900s, trust in medicine had been deeply shaken by false claims, unregulated cures, and corporate exploitation. Reform became not just a policy issue, it was a moral necessity. The Pure Food and Drug Act and the moral activism of religious groups laid the foundation for something that still matters deeply in clinical engineering today: accountability. Today's clinical engineers uphold this legacy. They protect patients not only with their tools, but with their commitment to transparency, safety, and ethical systems. In short, clinical engineering didn't emerge in a vacuum. It was born from a time when medicine needed guardians of both trust and truth.